Welcome. In this video, we'll be exploring gastric cancer, commonly known as stomach cancer. We'll delve into its causes, how it develops, its prevalence, symptoms, diagnosis, treatment, and ways to potentially prevent it. This information is intended for educational purposes and should not be considered medical advice. Always consult with a healthcare professional for any health concerns. So, what exactly causes gastric cancer? The etiology of gastric cancer is complex and multifactorial. One of the major culprits is infection with Helicobacter pylori, a bacterium that can live in the stomach lining. Long-term infection can lead to chronic inflammation and eventually, cancer. Other risk factors include a diet high in smoked, salted, or pickled foods, and low in fruits and vegetables. Smoking and excessive alcohol consumption are also linked to an increased risk. Genetic predisposition plays a role as well. Individuals with a family history of gastric cancer have a higher chance of developing the disease. Certain inherited conditions, such as hereditary diffuse gastric cancer, significantly increase risk. In some cases, previous stomach surgeries or conditions like pernicious anemia can also contribute to the development of gastric cancer. While these are established risk factors, it's important to remember that many individuals develop gastric cancer without any identifiable risk factors. Let's understand the pathophysiology, or how gastric cancer develops. Gastric cancer typically begins with changes in the cells lining the stomach, a process that often takes many years. Chronic inflammation, often due to H. pylori infection or other irritants, can lead to precancerous changes such as atrophic gastritis and intestinal metaplasia, where the normal stomach lining is replaced by cells resembling those of the intestine. Over time, these changes can progress to dysplasia, which are abnormal cells with a higher risk of becoming cancerous. Eventually, these dysplastic cells can develop into invasive gastric cancer, where the cancerous cells penetrate deeper into the stomach wall. The cancer can then spread to nearby lymph nodes, and ultimately, to distant organs like the liver, lungs, and bones. The specific mechanisms involved in this process are complex and involve genetic mutations, alterations in cell signaling pathways, and changes in the tumor microenvironment. Epidemiologically, gastric cancer is a significant global health concern, although its incidence has been declining in many parts of the world. However, it remains particularly prevalent in East Asia, especially in countries like Japan, Korea, and China. Incidence rates are also relatively high in parts of Eastern Europe and South America. In the United States and Western Europe, gastric cancer is less common. Age is a major risk factor, with most cases diagnosed in individuals over the age of 50. Men are generally more likely to develop gastric cancer than women. Understanding the global distribution of gastric cancer is crucial for implementing targeted screening and prevention strategies. What are the telltale signs and symptoms of gastric cancer? Unfortunately, in its early stages, gastric cancer often presents with vague or no symptoms, making early detection challenging. As the cancer progresses, symptoms may include persistent indigestion, heartburn, a feeling of fullness or bloating after eating a small amount, nausea, vomiting, unintentional weight loss, abdominal pain, and fatigue. More advanced stages can cause blood in the stool or vomit, difficulty swallowing, and jaundice if the cancer has spread to the liver. It's crucial to consult a doctor if you experience any of these persistent symptoms, especially if you have risk factors for gastric cancer. Remember, early detection is key for successful treatment. How is gastric cancer diagnosed? The diagnostic process typically involves a combination of tests and procedures. An upper endoscopy is a crucial diagnostic tool. A thin, flexible tube with a camera is inserted through the mouth into the esophagus, stomach, and duodenum, allowing the doctor to visualize the lining of these organs and identify any abnormal areas. Biopsies, where tissue samples are taken during the endoscopy, are essential for confirming the presence of cancer and determining its type. Imaging tests like CT scans, MRI, and PT scans are used to assess the extent of the cancer and whether it has spread to other parts of the body. An endoscopic ultrasound, where an ultrasound probe is attached to the endoscope, can provide detailed images of the stomach wall and nearby lymph nodes. Blood tests may also be performed to check for anemia or other indicators of cancer. These tests, when used together, help doctors accurately diagnose and stage gastric cancer. Gastric cancer is classified in different types based on the appearance of the cancer cells under a microscope. The most common type is adenocarcinoma, which originates in the glandular cells lining the stomach. Adenocarcinomas are further subdivided into subtypes, such as intestinal and diffuse types, each with different growth patterns and prognosis. Other, less common types of gastric cancer include lymphoma, which originates in the immune system cells, gastrointestinal stromal tumors, GASTs, which develop in the specialized nerve cells of the stomach wall, and carcinoid tumors, which originate in hormone-producing cells. The specific type of gastric cancer influences treatment decisions and expected outcomes. Treatment for gastric cancer depends on several factors, including the stage of the cancer, its location, the patient's overall health, and personal preferences. Surgery is often the primary treatment option, especially for early-stage cancers. A partial or total gastrectomy, involving the removal of part or all of the stomach, may be performed. Chemotherapy, using drugs to kill cancer cells, is frequently used before or after surgery to shrink the tumor or eliminate any remaining cancer cells. Radiation therapy, using high-energy rays to kill cancer cells, may also be used in combination with chemotherapy. Targeted therapy, using drugs that specifically target cancer cells, and immunotherapy, which boosts the body's immune system to fight cancer, are newer treatment options that may be effective in certain cases. Supportive care, including pain management and nutritional support, is also an important part of the treatment plan. Treatment decisions are typically made by a multidisciplinary team of doctors, including surgeons, oncologists, and radiation oncologists, working together to provide the best possible care. Can gastric cancer be prevented? While it's not possible to completely eliminate the risk, several strategies can help lower your chances of developing the disease. Eradicating H. pylori infection with antibiotics is a crucial step. Maintaining a healthy diet rich in fruits, vegetables, and whole grains and low in smoked, salted, and pickled foods is recommended. Quitting smoking and limiting alcohol consumption are also important. For individuals with a family history of gastric cancer or certain genetic conditions, genetic testing and prophylactic surgery may be considered. Regular screening, particularly in high-risk populations, can help detect cancer early when it's most treatable. Lifestyle modifications and proactive healthcare can significantly reduce the risk of gastric cancer. Finally, let's discuss the prognosis and recent research. The prognosis for gastric cancer varies greatly depending on the stage at diagnosis. Early-stage cancers, detected before they have spread, have a much better prognosis than advanced-stage cancers. The overall 5-year survival rate for gastric cancer is around 32%, but this number can be significantly higher for early-stage cancers. Ongoing research is focused on developing new and more effective treatments, including targeted therapies and immunotherapies. Researchers are also working to identify biomarkers that can help predict which patients are most likely to respond to certain treatments. Early detection and advancements in treatment are continuously improving the outlook for individuals with gastric cancer. Thank you for watching.